Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University's Innovation Center, which is the Alan B. Levan Innovation Center. And it's a combined element of Broward County and Nova Southeastern Universities investing in the future. So today we have the topic is ALS, recently approved treatment and ongoing research. And we have one of our significant experts, Gustavo Almeida, who is a neurologist and an ALS specialist. And I believe you are in charge of the ALS Center of Excellence at Holy Cross Hospital. Welcome, doctor.
Well, thank you, sir. Dr. Lippman, thank you so much for this opportunity to be here. Yes, I am the director of the ALS Clinic, which is an ALS Center of Excellence, as you mentioned, which is a designation that's provided by the ALS Association, which helps bolster the quality of care that the patients receive in our center and other centers similar to it.
By the way, congratulations. I know that you just received within a short period of time back, I don't know when, but you were certified, which is really a magnificent medal on the chest of the people at Holy Cross Hospital.
Yes, absolutely.
And also, I'm sure that you had some wonderful benefactors from the community that participated. Particularly, I know Mr. Smith, and I don't want to leave anyone out, but I know that it was it's a wonderment how, we always say, our president, Dr. Hanbury, always says that the greatest privilege that he has is not being president of the university, but receiving the benefits, or he calls the treasure of the community to invest in young people to do good for the future. So I guess that's what's happened.
Yeah, no, I did want to touch on our benefactors. The center wouldn't be here if it were not for the gift that Phil Smith provided, plus the other donors that helped contribute as well to help set up this state-of-the-art facility, taking care of not only ALS but patients with movement disorders such as Parkinson's disease and similar disorders as well, which was the main focus of the endowment.
That's the most important thing. Being a good doctor and being a neurologist and an ALS specialist in creating the ALS Center of Excellence. Explain to the folks, because again, I don't want to say that I'm advanced in age, and I can remember the multiple times that I've heard about Lou Gehrig's disease, all right, which is ALS. So why don't you take it from there?
Sure. So ALS is a neurodegenerative disorder, which is a mouthful, but basically what we're talking about is the degeneration and basically the death of motor neurons in the brain and the spinal cord. And these are the nerve cells that help drive movement, and most of it is voluntary movement. So your arms, your legs, your speech, your breathing, your swallowing. All of these aspects of neurologic function become impacted by this disease as it advances. And we don't really know the actual cause of the disease. There are many theories pertaining to dysregulation of anti-inflammatory regulation within the nervous system that results in some type of toxicity to the nerve cell that eventually dies. Most of this disease is what we consider sporadic, and by that I mean it doesn't have a genetic component. There are about 10% of cases which are related to genetic mutations. It's possible that more of what we consider ALS may actually eventually fall into a genetic category as more genes may be identified that we just really haven't identified yet. But it is a relentless disease, and the typical survival is 3 to 5 years after the onset of symptoms. There's great variability within that. Some patients may not make it 6 months after onset of symptoms. I've had patients that have had the very slow, insidious course that it goes beyond 10 or 15 years. So there's not a definite course that everyone will have. But we see about between 5,000 and 6,000 patients per year in the United States get diagnosed with ALS. The prevalence, so how many people are living with it at any one time, is about 30,000 people. This is it's you could imagine how devastating it is to lose control of your body, but it doesn't just affect the patient, it also affects their families. So it's that 5,000 plus however many family members are involved in the care. So it becomes it's devastating on multiple planes all at once. And it requires a lot of care that increases as patients advance. Their survivability will depend on whether the patient is willing to accept some type of life prolonging treatment. And by that, I mean feeding tube to maintain nutrition and hydration as the swallowing is impacted, a ventilator to help them breathe as the breathing becomes impacted. Not everyone decides to do that. A lot of people want just to take a natural course, and we respect that. And we provide everyone the choices, that the options that they have, and we kind of let the patient steer the boat in terms of what they want to do with their lives. That being said, most people do get a feeding tube, but very few people get a tracheostomy for permanent ventilator care. The treatments for this disease up until the last 5 years have been limited to just one medication that was FDA approved about 25 years ago, with probably fairly mild effect on the disease course. Just in the last 5 years, we had one IV medication get approved, which subsequently had an oral form approved earlier this year, and a second medication, a third oral medication that was approved this year as well. That's kind of been in the ALS community's viewfinder for the last several years, because there had already been some suggestion that it might be helpful as a treatment for the disease.
I think one of the things that has happened is, now that we've started to certify these centers in dominantly really major metropolitan areas, you're starting to see many more individuals starting to understand the elements of the structural changes and the conditions that are associated, which you enumerated, for ALS, Lou Gehrig's disease. And I keep on saying that because I must have gotten 4 or 5 comments about, tell us about Lou Gehrig's disease. So how is a person brought to you? I would assume they're brought to you by the intermediary physician, whoever it might be, the neurologist, it could be anybody, really. Any one of your colleagues can get the patient to you. So let's talk a bit about that.
Sure. So one of the real difficult and kind of tragic difficulties with this disease is that it takes up to a year or sometimes longer to actually make a diagnosis. That's time, and you may recall I said earlier, it's, from symptom onset, average survival is 3 to 5 years. So spending a year trying to find out what's happening is a challenge. So sometimes, we often see our patients that wind up coming to us having already seen several neurologists, that eventually come to the conclusion that it probably cannot be anything other than ALS or some variant of it. There are also patients that start off and have, let's say they develop a weakness in the leg and they have some back pain, so they decide to go see a spine surgeon. The spine surgeon will say, hey, you've got this finding on an MRI. Maybe that's what's causing your weakness. Let's operate on your back, or let's operate on your neck for similar findings. And it doesn't fix their problem, because that's not their problem. And what unfortunately winds up happening is that our patients who undergo surgery tend to have a more accelerated decline during the immediate postoperative period. And we see this over and over again. So by the time patients have arrived to us, in most cases, they've already had a fairly extensive workup. We're not typically getting a lot of patients in which we're starting from scratch in terms of the diagnosis. But it's a lot of hours and weeks and months of diagnostic testing before they get here. In part of that delay, I have found that there is a certain reticence in community neurologists to deliver that type of bad news to patients, to kind of set them up for that. But that's kind of my gestalt, because a lot of these patients have a fairly obvious course from the beginning. But if I'm a carpenter and I have a hammer and a nail, I see the hammer and the nail wherever I go. So that is a little bit different. But the patients come to us. They come to us with in most cases, their entire families, and they come in different stages of the disease process. Some patients will come to us already in a wheelchair, but they have no other equipment. It's a manual wheelchair that's not customized to them. They maybe have stopped walking already, and family is very concerned because they have a million questions, just like the patients do. And unlike Alzheimer's, where the patients tend to be relatively physically fit and ambulatory and can do things for themselves, that is something that quickly goes away with ALS, unfortunately. That is not to say that there are no cognitive impairments in the disease. There is kind of the spectrum where there is what's referred to as frontal temporal dementia. It's not Alzheimer's. It's a different form of dementia that we see with ALS, and it more often seen in the familial forms, but we do see that as well in the sporadic forms of the disease. So it's all shapes and sizes come to us.
What I was going to ask you is that's very common. Unfortunately, I had a member of my immediate family that was a victim, and that's what I'll call him, of ALS. And that's exactly what happened. Exactly what happened. First it was, I hurt my spine. I couldn't walk. I tripped and I fell. It's all because of that. Went on to see, various subspecialists. And I don't blame them in any circumstances. It's more, in the case of this particular individual, there was never anything that he could not conquer. He was just an impulsive, good person, wonderful father. Was very handy, built furniture, went on to, a big sports fan, kept on going, but yet, it was over. I mean, real fast. I would say less than 6 months it was over. And I'm just wondering, because I think the certification of these centers will do an awful lot to bring information out to the community at large. Particularly, in Florida. I mean, we have this huge population of individuals, and I don't know whether it's, and again, you'll answer this, I don't know whether it's age specific, but it seems to be later on in age. I don't know what the age elements are, and you'll tell me in a minute.
The ALS Association has actually been around since the late 1990s, where they started to provide these certifications for multidisciplinary care of ALS patients. And I want to actually, before I go forward with that, you mentioned the term, you're referring to your family member as victim of the disease. The ALS community actually strays from that type of language, and by community I mean the actual patients themselves. And they've labeled them. There's this big movement where they have labeled themselves as persons living with ALS. And that living is kind of the dual, dual entendre. They're living with the disease. They're dealing with it day to day, but they continue to live their lives. So the abbreviation that has become very common is PALS, PALS. Persons is the P, and then the living with ALS part gets kind of slammed in there. But it's definitely while yes, a devistating disease that most people would consider as an affliction and being a source of victimhood. There are many of our patients that have turned that on its head and want to make it clear that they continue to live despite the disease. But let me jump back to where we were. Yes, so the ALS Association's efforts to increase awareness resulted in the Ice Bucket Challenge, which occurred I want to say 2018, if I'm not mistaken. That is one of the things that really propelled ALS from being Lou Gehrig's disease to being more in the public consciousness. It is more people are definitely aware of what it is. There are still some people who have no idea what Lou Gehrig's disease or ALS is. But the compared to 10 years ago, the awareness was not there. So it's this public outreach and advocacy to try to get the word out is what has made this successful in terms of helping to fund more endeavors to not only make patients living with ALS have a better quality of life, but also help spur treatment, the discovery of new treatments, which is really what the Ice Bucket Challenge resulted in. Was it led to funding for the discovery of new treatments. So the ALS Association has a very easy to navigate website that lets you access different sites, that lets you find the sites near you. The state of Florida has 5 such centers. There are an additional 3 that are not centers of excellence, but are affiliated centers that are very similar, but don't meet don't check all the boxes required to make it a center of excellence, but still provide wonderful care to patients with ALS. And that's scattered all over the state. And as you mentioned, unfortunately, it's in urban areas primarily. There are patients living in rural areas where care is sporadic. I just went to a meeting last week. It was the first in-person medical conference I've been to in a couple of years because of stuff going on with a certain virus. And one of the items of discussion were ways in which clinical trials could even become more decentralized, so that patients living in rural areas or suburban areas that may have transportation issues can perhaps try different treatments, and that's kind of a focus that we're trying to shift to. You had mentioned about the age of onset. Average age of onset is actually 50s and 60s, but we've had some patients in their 20s, unfortunately, come to our center for care. Usually beyond 70 or 80, we don't see too much of it, but we do see some of it. We've had recently a 90-year-old patient, previously very healthy and normal, slowly started to lose her speech, and it's ALS. But lived a very full and happy life, and she's still chugging along. I mean, she's lost her speech, her swallowing is more difficult, but she's living her life. The younger people, when I see people younger than myself coming in with what can only be ALS, it really rattles you, particularly when you're in your 20s. We have one patient in her 20s who has 2 small children, and continues to live her life as well and raise their kids. But knowing that there's that her time is probably limited with them.
In an oversimplistic question here, it came from one of our viewers, because you spoke about it before. There were no indications of any of this occurring with her loved one, and yet. Is there any? I know there's a lot of research going on, and you mentioned the fact that there is no genetic imprint, it seems. At least that's what I thought you said.
For most cases, yeah,
For most cases.
about 90%.
So, well, that's pretty high. Even at Cornell, 90 was pretty high, right? So I would say to you that we're in an area where we're starting, and Florida is a wonderful region for this to be viewed at, because we have so many people that I would assume in that group of individuals that it's somewhere past the age of 60, et cetera. Although there are, as you said, there are patients. So I think the more that this gets out into the community, into the public, the condo groups, to the homeowners groups, to whatever, to the elected officials who are responsible for putting aside monies for certain programmatic entities, whether they be centers of care or whatever it is. The more that's placed in that venue of thought, I think the better it is as to what ALS is all about.
Absolutely. The state of Florida actually has a fairly large fund that is geared towards helping run our ALS centers of excellence. That this is part of the advocacy that at the governmental level that the ALS Association has participated in. So they help us fund our operations, thanks to the state.
No, I'm aware of that, and I'm very pleased to see that, because I think for many years the state recognized the elderly and the people who were not able, particularly the elderly. I'm not saying that fits only into ALS. I'm talking about particularly the elderly, because there were feeding centers, there were Alzheimer's centers, et cetera, et cetera. I'm very glad to hear that there is a foci on ALS. I think it would be valuable not only to the people out there, but to the many healthcare providers that are colleagues of yours that are left almost speechless to know what is going on here. I mean, not that they don't have the knowledge, it's just that it's something different. It's like tripping over a piece of the sidewalk that's never been raised before. I mean, that's the way I look at it. We're down to the last couple of minutes of this show. I want to thank you, because I think that on behalf of the viewers, your advocacy is a blessing. It really is. And I refer to the fact that the ALS Center of Excellence at Holy Cross is now a venue that has been designated as a Center of Excellence for ALS, which is very important. You'll be involved in research, you'll be involved in patient care reports and things of that nature, and I want to thank you for all your hard work on behalf of the people that are watching, all right? Remember that folks, that this show is called Dateline Health, and the only way that you can do all of us a favor is communicate with your doctors. Communicate with your doctors. Don't hide anything. Don't say that, oh, this has been bothering me, or I can't swallow, I can't. You have to report it. Don't go into a pharmacy or a supermarket and take something over the counter and just think it's going to go away. You got to go speak to your doctors. Remember, your health care is in your hands, and the more that you communicate with the medical professionals, the better off you are. This show is called Dateline Health, and we have an address and a email number right here. Remember, we're here to help you. My name is Fred Lippman. This show is called Dateline Health. We come to you from Nova Southeastern University. Until next time, see you.